Welcome back to the Move Better Project. The levator scapulae is a really important muscle when it comes to neck pain. I'll tell you why. You have a couple muscles that can do the action of elevating the shoulder blades. There's the upper trapezius, which most everybody knows about, the upper trap here, and then there's levator scapulae. It goes from the corner of the shoulder blade, the top middle corner of the shoulder blade here, and attaches into the middle of the cervical spine, about C4 or so, and it's a diagonal line like that. The upper trap attaches out here to the spine of the scapula, and it pulls up and inward like this, so it helps you to elevate your shoulder blade up and over your head. Because the levator scapulae connects in here to the medial side, it actually does the opposite, which is downward rotation, where the middle of the scapula comes up. So if you have a lot of tightness in the levator scapulae, that can cause problems both getting your arm up overhead, but also because of the positioning and the angle with rotating your head or laterally flexing your head to the opposite side. So it's a big factor in neck pain, especially of the mid-cervical spine. And I did a video way back in the day about mobilizing the levator scap for shoulder flexibility, and that one's great. But today I just want to look at what you would do a little differently if you're more focused on getting more flexibility in your neck. All right, so we're down here with ground level vision, and I want to take this lacrosse ball and I'm going to put it right on the top middle corner of my shoulder blade where the levator scapulae inserts. So I'm just going to reach over my head, feel for, there's a spine that goes across the scapula from outside to inside, and then I can also feel the medial border. And right at the top corner where those two meet, that's going to be the levator scapulae insertion, and you'll feel it. It feels thick, it feels ropey, it feels tight, it feels tender. Usually some people will even reproduce a headache pain or shoulder pain if you really have a dysfunction in that muscle, but the ball's gonna go right there, okay? And if I'm mobilizing the shoulder, I'm gonna do reaching up overhead, but that's a whole other video. We already did that one. Because I'm focused on the neck, I'm going to first just roll over the muscle back and forth and just find, you gotta fiddle around with it a little bit, especially if your lacrosse ball isn't very tacky. This one's a little slippery. I just wanna find a spot where, okay, that's really tender, it's really tight, feels like I need to give it some attention. So I've got pressure on the levator scapulae muscle, and I'm just kind of holding my arm in just a neutral position. It can be wherever, straight up, in here in a chicken wing, whatever. I just got mine straight up in the air. If I want to stretch the levator scapulae muscle, thinking about fixing the shoulder so I'm not moving the shoulder, I want to rotate my neck away and laterally flex away, because the fibers of that muscle are oriented such that they'll flex the neck laterally to the same side, ipsilaterally, and then they will rotate the neck also to the same side. So I'm going to laterally flex, or kind of tilt my head away from the side that I've got the lacrosse ball on, and I'm also going to rotate away from the side. So first I'm just going to do a couple deep breaths. I'm going to breathe in. Once I feel like I've gotten that to calm down a bit, then I can breathe in, flex that muscle or contract it by pulling my shoulder blade up and in, contracting that levator, and then breathe out and just relax. Then I can also add in tack and stretch. I can breathe in, get a little bit of contraction, and then breathe out, tilt my head away, twist it away from that side. Don't push through pain or push this past what you can tolerate in terms of movement, but you want to just spend a little bit of time, and you can play around. Maybe you're more limited in lateral flexion, or maybe you're more limited in rotation, but pick whichever movement needs the most attention and just spend some time here. And if this muscle's really tender, you might just lay here for 4 or 5 minutes and just take deep breaths. That's totally fine. You got to meet yourself where you are. But however long for you, once you feel like that muscle start to relax, you can move the ball around, find a new spot, but spend about 5 minutes total working on the levator. All right, so there you have it. A quick little release for a very tight, very problematic muscle for both the shoulder and neck called levator scapulae. You may or may not notice right now, if you look at me from the front, my right shoulder, which I just worked on a little bit, is sitting lower than my left because I've relieved a lot of that tension in the levator on that side. So see if you get the same results. Leave a comment below, let me know how it goes. Make sure you're subscribed to the channel, and I'll see you next time.